Hello everyone, I am Dr. Rana Choudhary and today I'll be talking about in vitro fertilization, IVF, or commonly called as test tube baby. It's basically a procedure in which the egg or the female gamete is combined with the sperm outside the body and hence called in vitro. During IVF, the woman is given certain hormonal injections to increase the eggs in her ovaries. During this, the lady is monitored with the help of ultrasonography. Once the egg are of adequate size, that is 17-18 millimeters in diameter, they are removed with the help of a small procedure called as oocyte retrieval. The husband's semen sample is then processed and the good motile sperms are used for IVF or in vitro fertilization. In this case, the egg and the sperm are mixed together in a petri dish and the resulting embryo, which is created from the fusion of the egg and the sperm, is transferred back later, maybe on the third day or sometimes in the blastocyst stage, back into the uterine cavity. This procedure is called as embryo transfer. Following the embryo transfer, the woman is given certain medications in the form of hormones progesterone, either as injections, oral tablets, or vaginal suppositories to support the pregnancy. This is given for around 12 to 14 days. After this, a blood test is done called as serum beta HCG to know whether she is pregnant or not. Basically, the steps of IVF include ovulation induction, wherein we get injections to increase the egg size, the pickup or the oocyte retrieval, fertilization, and embryo transfer. Women who have bilateral blocked fallopian tubes, anovulatory women, that is women who are not producing eggs, will require IVF, by which the eggs can be grown and can be fertilized with the sperms outside their body. It is also used sometimes in women of higher age, wherein the number of eggs have reduced in your body. These eggs are then collected outside your body by a simple procedure called oocyte pickup. This is done under sedation or general anesthesia. The procedure requires maybe around 10 to 15 minutes and is done on a daycare basis. The eggs are then mixed with the husband's processed semen sample and this is then placed inside the incubator. The embryologist checks for the fertilization the subsequent day and then these embryos are allowed to grow. The incubator has an ideal condition for the cells to multiply. Once they are of good grade and good number, that is either on day 3 cleavage cell or on day 5 blastocyst, they are transferred back into the womb, that is into the uterus, by a simple procedure called embryo transfer. Some men may have severe oligoasthenospermia, that is decrease in the sperm count as well as sperm motility. In these cases, intracytoplasmic sperm injection or ICSI is used. Basically, in this procedure, a good sperm visualized under the microscope is selected. It is then immobilized and then inserted into the cytoplasm of the egg of the woman. This allows for fertilization of the eggs even in cases of severely reduced count and motility of the sperms. Test tube baby, IVF and ICSI has revolutionized the treatment options for infertility in cases of blocked fallopian tubes, in women who are anovulatory, and especially in males with severely low sperm count, and low sperm motility. The success rate of IVF depends primarily on the cause of infertility, the age of the couple, especially of the women. Generally, it's around 30 to 40%. That means that out of 10 couples undergoing IVF, 3 to 4 women can get pregnant in the very first cycle. Thank you, everyone.